Welcome, everyone, to the final IGCS Patient Perspectives Roundtable of 2021. The title of today's discussion is Committing to Global Health Equity, More Than a Statement. My name is Mary Aiken. I'm the CEO of the International Gynecologic Cancer Society, and I'll be moderating this session. I'm thrilled to have an amazing panel of speakers with me today who will be sharing their perspectives and knowledge. With me today is Melissa Rendler Garcia. She's the Global Special Advisor, representative from the UICC. Clara McKay, CEO of the World Ovarian Cancer Coalition. Dr. Daniela Luvero, she's an IGCS Council member and very active in our advocacy efforts. Dr. Michael Quinn, past president of IGCS, very passionate about this topic. And Karen Livingstone, an ovarian cancer advocate for over 20 years. Our discussion today will focus on this concept of global health. We hear this term a lot, and our goal to achieve the absence of systemic disparities in health, to allow the opportunity for every person to obtain his or her full health potential. IGCS developed a statement almost a year ago now, published in our journal, IJGC. The statement is embedded in the mission of the IGCS and reflected in the breadth of our membership and the design and implementation of all of our programs. Prompting and inspiring maximum achievable health outcomes for every woman and under whatever circumstance she might live are fundamental to social justice and human rights. We hope to provide those who are listening with a deeper understanding of some of these disparities and how leading organizations here today are taking actionable steps to ensure global health equity. Great, so thank you again, everyone, for joining. I'm really excited to have this conversation and to share a lot of what you all have been doing in the area. I was most excited, Melissa, when I heard recently, and I sat in on a webinar that UICC hosted, that World Cancer Day will be February 4th. And I think it has a very impactful meaning this year. Do you want to tell us a little bit about that?
Sure. Well, we just launched our new 3-year campaign recently, which will start on February 4th. You know, World Cancer Day is every February 4th. This year's theme for the next 3 years will be focusing on closing the gap in cancer care and treatment, and really focusing on the issues of cancer care equity and health equity in general. So for me in particular, it's very, very exciting because when we were developing the theme for the next 3 years, there was a lot of research that went into looking at issues of disparities, social determinants of health and cancer, to see how best we can highlight the issue and where we need to go, right? We did about 9 months of research. We did a lot of interviews with our members around the world. We did a really internal analysis as well on projects in the cancer control space globally and nationally that are really focused on trying to bridge the gap and reduce just disparities for cancer patients, particularly among vulnerable populations. So it was very interesting to see where the cancer control community is relative to other issues in public health in looking at issues of equity, and we still have a long way to go. So this is great to see that we're going to be doing this. It makes me very, very proud. And also it's very heartening to see member organizations like yourselves really looking at the equity issue, because there's a lot that we need to do, but there's a lot that we can do. And the great thing about this campaign is that it takes a very, very positive step towards not only trying to inform people a little bit better what equity is. We need to unpack what that means, what are social determinants, what's the difference between equity and equality, try to empower people within their own space to do something to help remedy issues related to disparities, and then also help galvanize support to actually make positive, constructive policy change by year 3. So that's where we're at. I'm happy to talk a little bit more about research and stuff like that as we go on in the panel discussion.
Wow, that is an ambitious 3-year goal. But UICC has the reach that's required in order to be impactful. Clara, I know that you guys have a lot of patient advocacy organizations as part of WOCC. I think I read like close to 200 maybe, is that right?
Yes, thank you, Mary. Yeah, 200 patient advocacy organizations from around the world, close to 45 different countries. And firstly, just to say, it really is just a delight to be here. And this is such an important topic. And Melissa, I'm just thrilled to hear about your plans for the next 3 years. It really is kind of music to our ears. And IGCS, congratulations and hats off for showing such leadership in this area. It's such an important issue. But from our point of view, we work with our patient advocacy organizations on a number of different levels. So firstly, we're very concerned about providing what we call strategic evidence, sort of global strategic evidence that shines a light on and provides the evidence to enable us to better understand health inequity and disparities in health. So we do things like we produce our global atlas, which is a global review of really the state of ovarian cancer around the world and where there are pockets of challenging areas. Our Every Woman study from 2018 really providing insight into the experiences of women living with a diagnosis of ovarian cancer. So 1,500 women from around the world. Our treatment mapping work. And we do all of this work from the perspective that from the center, we want to kind of speak at that global level, but actually really create data that empowers organizations working at national level, because that is where change will be driven. So, it's the strategic evidence, it's the empowerment of our patient advocacy organizations on the ground. Increasingly, we're fostering the development of patient advocacy movements and organizations on the ground, because quite often, as we have learned through our work, where you most need challenge and ambition and change is possibly where there is least likely to be resource to really support those advocacy movements. So that's how we operate. It's at a number of different levels. And indeed, we work very closely with individual clinicians and organizations like IGCS and UICC, because the collaboration, those of us with a global kind of perch, I think really are morally bound to collaborate and support each other's efforts in this area.
Yeah, it's fun to work together, like you said, and we all have different reaches and bring different strengths to the table. I like that a lot. Michael, where do you think the most prevalent health disparities are right now in women's health?
Oh, I think that's a great question. Obviously, we're preoccupied with the cancer area, Mary, and without a doubt, cervix cancer, I think, is the biggest divide. It's a disease that particularly affects women in low and middle income countries. And we know that those women are already severely disadvantaged with other health issues and other reproductive health issues. So for me, it's looking at those women and trying to work out how we're best going to help them. And I guess this is where advocacy comes in, and where organizations like UICC and we learn from the ovarian cancer support groups, just how to mobilize local women and local governments and national governments to actually start addressing these issues. I remember a great statement by a WHO secretary, and he said that women are not dying because of diseases that we can't treat, but women are dying because society has yet to decide that their lives are worth saving. And I think that's very powerful, and it summarizes where we are with all this, that we've got to actually start addressing those specific reproductive health issues that affect women. And if you just take something like, child marriage, 25,000 teenage girls are married every day. And the vast majority of these are in low and middle income countries. And when you look at the downstream effects of that, there's forced abortion, there is fistulas, the majority of the 2 million women living with fistulas are teenage girls. So these are the things that we, I think, have to throw into the pot and say we're going to have to address a holistic problem affecting women in these communities. Cancer is just part of it. But if we use cancer as a model, it may direct other groups to actually do something that is more powerful than they can at the moment.
I think that's a great point, Michael. And I know, Karen, you have been a national voice for ovarian cancer patients. And I think it is important to mobilize. How did you become so passionate and involved and so effective over these past 20 years?
Yeah, so 20 years ago, the patients didn't really have a voice at all in any of change at government level. And it was actually Professor Michael Quinn who approached me and said, Australian women need to have a voice. So myself and 4 other people actually came together to found what is now Ovarian Cancer Australia. And so what was really important for us was to look at awareness, so to get information out there about ovarian cancer, because many women weren't even familiar with their gynecological reproductive areas. And so we also worked to support women. We created a kit which is called Resilience that could actually be given to every woman in Australia who was diagnosed with ovarian cancer, with practical advice and also areas where they could seek assistance and support. And then also obviously advocacy at a government level. And certainly that is where change really started to happen, when they started to listen and see outside of breast cancer, there was actually and other women's diseases that they needed to address.
Great. You know, it's been amazing, the work that you guys have been able to do. And here at IGCS, we're going to be kind of enhancing our advocacy efforts with a committee. And I'm excited to have Daniela Luvero, who's going to chair that committee. So there'll be lots of ways for us to further partner and collaborate with others. But Daniela, I know you're doing a very interesting genetics project in Rome. And do you want to tell us a little bit about that? I think it ties so nicely into disparities and finding these pathways where we can implement those in other parts of the world.
Yes, thank you, Mary. And it's a great pleasure for me to be here virtually with these wonderful speakers. And yes, we already started with an important genetic cooperative project. So as everybody knows, the genetic testing for gene mutation should be the standard of care for all women with epithelial ovarian cancer. So in fact, all guidelines worldwide recommend the genetic testing for those women. So unfortunately, despite technological advances, middle-low-income countries still lack adequate ways of identifying patients, so quality screening tools, genetic counseling, and public policies, so significantly impacting the treatment decision-making of healthcare practitioners. So this will be possible throughout the educational programs, outline genetic testing, patient pathways, and support policy shaping in order to implement the local guideline. So it's a crucial topic. So it would be great planning other similar projects involving also the patients association too, because the alliance is crucial in order to obtain the best outcome for our patients.
That's so great. And Michael, as a former clinician, what are your thoughts on this project and how you could see this maybe becoming really something that could catch on?
Oh, I think it's really exciting. And I think for the first time, we're actually doing clinical research involving women, because remember, women are disadvantaged in the global clinical research arena compared to men. And we're doing it in countries where the resources are not as obviously up to speed as in high-income countries like the United States. So, I mean, I think this is a terrific advance.
That's great. It's been a real passion for Danielle. It's been fun to kind of see it take shape over the course of the last 18 months or so. Let's go back a little bit on World Cancer Day. It really has caught a lot of buzz. I think there's so many people that know about World Cancer Day. Melissa, how can people get involved, those viewing today, whether it's patients or family members or people who lead other organizations? You guys do such a great job of engaging others in this important day.
Yeah, I mean, every year it just grows and grows and grows. So it's just really exciting to see the evolution and how people have, taken this on as also as part of their own advocacy planning and campaigns throughout the years. So there are a lot of different ways that organizations and individuals can get involved. So number one, there's a website. So there's the worldcancerday.org website, where every year we have a whole host of materials for individuals and organizations to be able to download, to use, to adapt for that day. we recommend a series of activities that organizations and individuals can also do. One of the things that we do, for example, is we invite, people to light up landmarks that day in orange. Also prepare and plan activities. We like to also track organizations and what they're doing that day. So we have kind of like a real-time tracker to be able to do that. For those organizations that are members of UICC, we have a fairly extensive committee that works on World Cancer Day to help us shape the design, the rollout, and we meet with them regularly to see how we can continue to support them. Throughout the months that come up to World Cancer Day, we will also be organizing a series of events related to specific aspects of inequities that we're going to look at. And one of the things that I love about this topic is that not only is it much needed to be discussed within the cancer world, but it's also something that equally affects high income, low income, and middle income countries, right? Yes, inequities are the greatest. Cancer is one of those examples where inequities are the greatest, where you see them in low and middle income countries in terms of survival. But we also are impacted, those of us who work and live in high income countries, by inequities. And I think that it just shows that it's a common thread that kind of affects all of us. So it's great to be able to see how people are also looking at and reacting to the social media campaigns that are now starting. I was just looking at the Instagram feed for one of the first kind of social media posts that we did. The graphic that, it shows the difference between what is equality and what is equity. And someone said, I am from, I'm a member of one of the First Nations in Canada. And I'm so happy that you're doing this, because this is the first time I feel that within the cancer world, my voice is being recognized and heard.
It's so fun to be a part of something like that, honestly. And I know, Clara, we at IGCS are thrilled to be partnering in this next phase of the Every Woman study. And timeliness is everything, right? I wish you and I, Clara, as CEOs could say, we knew this was all going to be perfect for health equity. But it really is, I think, going to help us open our eyes and address and truly engaging patients for feedback.
I totally agree, Mary. I think it's an amazing piece of work and a much needed piece of work. We are aware of the inequities. We know they're there, we can see them. But again, going back to that, being able to evidence the experiences of women and the experiences, importantly, of clinicians as well, being able to enhance those relationships between the patients and clinicians, being able to help to foster organizations where perhaps they haven't existed before. But the Every Woman Study Low and Middle Income edition is perhaps the most important piece of work. I think that the coalition is involved in it, really. And I think, Mary, you'll know this from our meetings with the Oversight Committee, just humbling, so humbling, the level of commitment and interest and enthusiasm and the time that clinicians and patients from low and middle income countries are making to commit to this piece of work and to be involved in it. And, we hear from them, this is so important for us. This is, we're evidencing this experience. We're going to be able to identify and be able to quantify where barriers are and where inequities exist, and importantly, use that to leverage change. So I really feel, and even just doing our testing off the survey for the study just threw up some just really important insight about the need for access to financial support, the need for access to practical support. Women who, and Michael, I'm so pleased that you talked about, sort of the women's rights and gender. We know from colleagues, for example, in South Africa and in India, in another piece of work, that a diagnosis of ovarian cancer really is catastrophic for a woman. It's their value in many places is nil at that point, and they are so disadvantaged. It's quite shocking actually to see that contrast. So just being able to pull that together, to work with that amazing network of clinicians and patients in those low and middle resource settings is just, I think it's going to be a very, very powerful and impactful and I think far-reaching piece of work. But also, I believe, Melissa, I really loved your point about, and it's really important we don't lose it, which is, there are health inequities in high income settings as well. And we see that in our work as well. So, it's just a really, and I think really the challenge is how do we, through our respective, our strengths and our reach and our networks, how do we collaborate and collectively, tackle this problem, whether my interest is ovarian cancer, but I work every day with women, with organizations that are about women's health, that are about gynecological cancer. So, we must really look for those opportunities to collaborate, to address some of these barriers.
One of the comments I wanted to make to both you, Clara, and Daniela is, when I did the research on disparities and equity, I did a very detailed PubMed search on what articles existed, research published articles on equity and social disparities in cancer. Cancer compared to very little. I mean, probably about 2% within the last 20 years. It's growing. So this is why it's so important on many different levels that you do multi and interdisciplinary research on cancer and equities and disparities, and where you are bringing in the patient perspective and looking at different areas, bringing in folks within the research from low and middle income countries and publishing. Because as you know, and you said it, in order for us to affect change, we need to have it documented, right? We need to have that both in, the indexed articles, but also in the informal literature. We need more things that are published on every level to be able to.
Couldn't agree more.
Mm-hmm. So yay, keep on doing it, please. Need it.
Karen, do you have thoughts on this?
Yeah, I do actually. What sprung to mind was the inequities in the comparison to Australia versus right across the east to New Zealand. Australia sits at a 48% survival to 5 years for ovarian cancer, whereas New Zealand is 37% to 5 years. Now, both are Western countries and reasonably high standards of living, and yet something is falling short in New Zealand. And I believe it's access to new and emerging treatments and drugs coming out.
I believe you're right. We did recently a treatment mapping exercise where we looked at 13 low to middle high income countries and 15 different ovarian cancer treatments. And New Zealand wasn't one of the countries, but we shared our results, and they're not surprising, but they're quite shocking that, if you're in a lower middle income country, your access is so limited. It's just really, and it's out of pocket expenses that you're paying for treatments that, women in Canada or the US or, are where they're either health insurance or, yeah, exactly. However, our one of our member organizations from New Zealand shared a post relating about this piece of work and said, here's something interesting. New Zealand looks, when I look at this chart, New Zealand is closer in profile to a low income country in relation to access. So you're super right. It's just, very, very interesting and very concerning.
I want to get back to our committee that we're developing, Daniela. I wonder, Michael, if you don't have any advice for Daniela as she thinks about what a advocacy committee will look like within IGCS.
Oh, listen, I'm sitting here amongst, world experts on this topic. I think it's like all committees that you need people, first of all, who are passionate. That's the number one thing. That's what drives us all. And it's that commitment and passion that you want that will affect change. And then you have to have people on your committee that are strategic. So strategy is everything, I believe. And I take on board the comments about getting to national governments, because that's really the key. And if you look at somewhere like, the United States, Mary, the Office of Women's Health, which is part of the CDC, has made a huge impact on women's reproductive health and other areas of women's health. So, I think getting governments to actually address globally women's health, I think would be a great step. So strategy is very important. And I think also you have to have people on these committees that are willing to spend extra time, you know, a lot of committees, they turn out to be populated by people who just want to be on a committee rather than people who are really committed and are willing to put in the extra yards. So I think those people are really, really important. And then, of course, you've got to have your patients and their families. And I don't know if IGCS has addressed this in their advocacy setup, Mary, because I've been out of the game a little bit. But, you know, obviously you need patients to give you direction. And you need people who are on this call to give you direction because they've got the runs on the board.
Definitely. And Daniela is so connected to the community of patients in her area and part of the world. So Daniela, do you have thoughts on that?
Yes. So about the inequities in Italy, we are very lucky because we have the NHS. So we don't have some disparities and inequalities in Italy, but it's different worldwide, unfortunately. So I'm in contact with many patients associations in Italy, but also abroad. And it's very nice to meet Clara in the past ESMO. And I think that the patients association work is very, very crucial. So I think the partnership with patients associations, companies, and IGCS, scientific societies, will be the real key and the ability to apply this intervention to other parts of the world where inequities exist, I think. So we need to reduce these disparities with the help of patients association. So I try to exploiting my professional skills, of course, to try to promote different projects in order to try to reduce the disparities all over the world. So, of course, we will continue to enhance the care of women with gynecologic cancer worldwide through education and training and public awareness, especially in the countries with real difficulties. So we reinforce the roundtables open to the patients. So it's important the patients. So every patient deserve the same standard of care, have the same rights to access to all new oncologic therapies and saving therapies in general. So regardless to the countries where they live or their social status or others. So to overcome all the disparities is impossible, we know. We need to try to reduce them with the only objective to assist our patients in the best way possible.
Mary, can I ask people what they think is the best way to measure the effectiveness of advocacy groups? Have we got a tool?
Yes, so that was actually my comment. So you kind of gave everybody a teaser. So one of the things that I was going to suggest to Daniela and to Mary is that as you are planning the development or the conformation of this committee, UICC has a lot of materials and tools to help you organize the way that you want to do your strategy and plan, because behind any successful advocacy activity, you really do have to plan it. You have to think about the strategy and how you engage multi-stakeholders. So we literally have a step-by-step guide, which is very general to cancer, which you can make very specific to IGCS, but those are easily available and downloadable. You know, we work a lot on advocacy and mentoring actually different organizations on doing advocacy. Particularly right now, we're doing a lot, particularly in the cervical cancer space with some organizations around the world with JPIGO through the Success Project on cervical cancer elimination. But those materials are there to be used, to be downloaded. If you need me to send you links so that you can view them, let me know and we will send those to you.
Yeah, there's no sense in duplicating efforts, right? There's a lot of gaps and holes to fill.
And they're brilliant resources, actually. They are really useful resources.
Are helpful. Mm-hmm.
Yeah, definitely. Great. Well, I feel like Daniela left us with a positive note, that it is a right, that every woman should have this opportunity. And I think we all can make a difference. So as we think about closing, I'd like maybe each of you to just a couple sentences of positivity, of hope, of how you feel we can change this?
Unfortunately, as we said, in the world exists this disparity. And the COVID-19 has changed the world even more in so many ways, I think. So in the way we conduct our practice, care for our patients, and our own daily life also. So I'd like to have a hope, because we can help patients also with the help of Patients Association according to AGCS, with the scientific societies. So it's important to stay close to the patients, first of all, and because for the patients, sometimes the Patients Association is the only way to have a link with the scientific societies.
Great. Karen, some inspirational words as we kind of close down?
Sure. Look, I think COVID has actually changed the landscape across the board. In Australia, we're a very geographically diverse country. I can actually say that telehealth has improved access for patients, but also access into clinical trials as well. So there is a movement to enable women who live in remote or regional areas to not have to travel the distance, but to certainly be involved in clinical trials. I think that's really important. I also think that I'm also hopeful that end of life can be improved for women as well, because I think that's extremely important. And I think the other thing that I really wanted to talk about was lack of knowledge. So endometrial cancer in Australia is a large concern. Lack of knowledge about nutrition and exercise is certainly something that needs to improve. And just finally, I wanted to say that I'm involved and have been involved since 2008 in work to improve patients and survivors into research, so that when concepts are being developed, women are actually having a voice at that level. And I think that that's extremely important going forward, for them to be heard and for clinicians to listen.
Nice. How about Melissa?
Words of inspiration. Well, I'm one big ball of excitement about about equity, but I think that, I think it's important for people to keep in mind that however small, every activity that helps shed a light on what these inequities are makes a difference in the long run, right? And we're hoping that we can kind of create or help empower a movement where we really do look at all these issues, both in our homes and around the world. So we are excited about the fact that there's so many people that have really responded so positively, and are really supportive of this theme. And I'm hoping that all of you will continue to join us on this journey for the next 3 years and beyond, and please feel free to reach out so we can continue this conversation, because we have to continue the conversation and have dialogues like this on different levels, right? And then get projects done so that we can actually start addressing some inequities.
Yes, that's the fun part, right? Doing projects together. Clara, any final thoughts?
Yeah, I do. Actually, it sort of picks up on that as well. It is quite overwhelming when you think that the task at hand, but I'm also a firm believer in, small changes can have a big impact, and we see that. So the two places I go to when I sort of a little bit kind of beaten down by, the challenges, and it relates to the Every Woman study. So we recruited a clinician and a patient advocate from Malaysia. They have no patient advocacy, ovarian cancer patient advocacy organizations in the country. Just by virtue of that connection, they have set up Ovarian Cancer Malaysia. And
wow.
And it's taken off. They have some, a really strong comms person that's working with them. They're getting lots of media coverage. They're really, and just the to see that momentum start from nothing is just really, really encouraging. And the other one was in Malawi, where our patient advocacy organization on the ground went. We asked if they could help us, identify centers or clinicians. And she went right to the Minister for Health and told them, about the study. And then, somehow everybody got very excited. And the ministry is leading the, outreach to clinics to be involved in the study. So it's, we have a big task at hand, but don't underestimate the impact of, small steps towards the goal.
Absolutely. And Michael.
Mary, I always go back to 2015 when we sat down in Miami to talk to people about developing our global curriculum about teaching and training in low and middle income countries. And it seemed such a huge task at that time. And people said it was impossible. You can't do it. 2 years later, we had our first programs up and running. So Daniela, I think that's exactly the model that you should be doing. I think I'm very optimistic that IGCS has got a major role to play. We've got over 3,000 members who, and if you translate that into the number of women who are being looked after by our members, we're talking about hundreds of thousands of women. And if we can mobilize some of those women to act as advocates for other women in the community, then I think we've done a good job. So I think we're on the right track. Very positive.
I think so too. And thank you all for joining me today. I hope it's been a good session for you as well. It's so true. These conversations are so important and we have to keep them going. I'd like to thank all of you again for joining me. And I'd be remiss in not mentioning Dicey. Unfortunately, Dicey couldn't be here today, and I'm so honored to have moderated this. And I know that she's so proud of all of us, this conversation we had today, and she'll be back with us soon, fighting even harder than she has in the past. So thank you again. I wish you all a happy and healthy new year. Take care.